Jude. My name is Anisha Gardner, and I work at Texas Heart Institute, Baylor St. Luke's at the Medical Center.
What is the latest medical technology pertaining to the heart?
The total artificial heart. We have been doing the total artificial heart over a number of years, probably about the last 8 years or so. And that is the latest, as people are waiting for a heart transplant.
Do you know where the artificial heart is placed?
Yes, it's placed in the chest cavity, right here, where your normal heart is. When if you put a hand on your chest, you can feel your heart beating on the left side. That's where the total artificial heart sits. So, when we implant it, it's called implanting the heart. We have to take the old heart out, or the patient's heart out, and replace it by a total artificial heart, which is more of a mechanical heart.
How does the artificial heart work?
It works with compressed air. You see this picture here? There's a little compressed air tank right here. So as the air goes into these cannulas, you call them, or tubes, into both sides, into the right side and the left side, there's a vacuum that brings the air in, and the vacuum, it goes up and down like that and displaces the blood through the rest of the body.
Like a real heart works.
Yes, exactly. So it mimics the heart. Very good.
I see these tubes coming out of the body. Where do they exit, and what does this machine of some sort do?
Okay. It's a good question. Okay, these tubes, if you look at the total artificial heart itself, they come out from the heart, but they exit the skin. So it comes out right from the skin. We make a hole here, and both tubes come out from the skin. They go to this tank here. It's called a tank. It's a compressed air tank. So we use the air from the outside. There are holes in this little tank here that actually comes in, and it's like a condenser. That's why we call it a compressed air tank itself. And that air, once it compresses, it goes up into the heart itself, the total artificial heart, which works like a vacuum, and it sucks the air. As it sucks the air in, it compresses it down like that, and disperses the blood through the body. So this exits the skin, and this is a compressed air tank.
Okay.
It's not very heavy. It's light. It's pretty light. As you can see from the other pictures, look at the young girl here. She's from Texas Heart, this young girl, right?
This is a multiple part question. How long does the surgery take? What is the cost? What is the success rate? And what are the age groups?
Okay. The surgery typically take about 8 to 10 hours. The age group for these patients, it depends. We have a smaller pump that could be implanted into like kids, younger children. And then we have a larger pump that could be implanted into the adult group. The patients that are listed for the total artificial heart, they must be on the transplant list, the heart transplant list. It is FDA approved, so Medicare pays most of the cost for the surgery. When the patients come out of surgery, they actually do very well. They have a breathing tube in their mouth, and the breathing tube is taken out within a couple of hours. They sit out of bed and they start walking very early, so they do good.